So welcome, my name is Karen Corman and I have the privilege of being the Executive Director of the UIC Alumni Association. We welcome you to the UIC Alumni Exchange Series. Throughout this series, we work to bring our alumni and friends a variety of programs and topics so you can explore, connect, and even escape from the everyday with a community of UIC alumni, faculty, and staff experts. You'll hear me say this a few times today, but I encourage you to visit go.uic.edu/alumni exchange for the latest and greatest programming. Before we begin today, I want to share some exciting news with you. We have recently launched UIC Connected, our online networking and mentoring platform. Please enjoy this quick video to hear more about UIC Connected. We hope you are as excited about UIC Connected as we are. You can go to go.uic.edu/connected to join today. I did see that we had somebody chat that they are a current student, and I should say we, of course, welcome all of our current students. So thank you for being here. And with that, I'm excited to start our program today as we are joined by UIC alumnus, Eric Meredith. We are grateful that Eric has been a longtime alumni volunteer and has served on our Applied Health Sciences Alumni Board. During this hour, Eric will explore and discuss how health professionals observe cultural cues to learn more about the customs and practices of their clients to provide the best care possible. Thank you so much, Eric, for being with us today, and I'll turn it over to you to begin the program.
Thank you for the introduction. Excited to be here. So let me start by introducing myself. So my name is Eric Paul Meredith. I'm a three-time alum at UIC, graduated from the College of Business in '94 with a degree in information systems, spent the majority of my career, the first half in IT and software during the internet bubble, and then went into public health and nutrition in the second half. And so I graduated from the College of Applied Health Sciences in 2012 with a master's degree in nutrition, the coordinated program. I'm currently a registered dietitian working for the Department of Agriculture, and I also do cultural competency consulting for Feeding America. And I also have a company called Health Heroes. One of the exciting things we do is right now is teaching kids about healthy eating. And I'm working with Chance the Rapper's social works organization to film healthy videos for kids, and then also do live classes as well. Also, the last letters, everyone always asks me about my alphabet soup and my acronyms, and my credentials. A certified health education specialist. So I teach some things outside of nutrition and physical activity as well, like tobacco cessation or substance abuse and so forth. So with that, we will get started with the presentation. If you have any questions for me, we will be reviewing the chat, and I did leave enough time for 10 to 15 minutes for Q&A afterwards. So before I start any presentation, I always like to start with my why. So why are we here? So over the course of my 30-year involvement with equity, diversity, and inclusion work, many people have asked me about my process to learn about other people's cultures. While my approach might work for me, I began to search for more universal approaches to share with people interested in increasing their cultural knowledge of our nation's diverse population. So during my research, I came across a scientific discipline that helps people learn more about others' cultures in a methodical way. So this is not a science presentation, but this is really giving you a really great tool and approach to learn about others' cultures that I found would be really great. So this field of study is called ethnography. Ethnography has been underutilized in healthcare, and the breadth and depth of this application in the field of nutrition and dietetics has been scarcely explored. So my aim today is to get a few people in the audience interested in using this approach to improve their personal and professional cultural competencies. So let's start by discussing how to improve nutrition interventions using ethnographic strategies. So thank you. And so improving nutrition and health of individuals and population depends ultimately on voluntary behavior change in an environment that does not prohibit the potential for this change. So for nutrition, there are social, economic, ecological, agricultural, psychological, and cultural determinants of health that facilitate or impede the potential for people to adopt behaviors that lead to better nutrition. Interventions to improve nutrition are directed at one or more of these sets of determinants. You kind of see a few on the slide. You see transportation being one, genetics and existing chronic disease, housing is really big, food environment, food access, family size, education, job, and so forth. So these are all determinants. So my presentation is grounded on the basic premise that designing and implementing effective interventions requires knowledge about the populations and communities in which interventions are situated, including knowledge from the perspectives of people who are intended to benefit from the behavior changes that are being promoted. So that's very important. So it's very important to, as you design an intervention, don't design an intervention that works on people, design interventions that integrate people and take their lived experience and their perspective into account versus coming up with something where you think may benefit a particular population. So next slide. So how do health professionals gain a better understanding of people they serve? So that's a really good question. As you look at this cultural wheel, you will notice that there's many dimensions of a person's cultural makeup. So some experts have recommended using ethnography, which is defined as the scientific description of customs of individuals, of people, of cultures. So to contribute to the knowledge that can be enable or improve nutrition intervention. So it's important to look at all these cultural factors as you design effective interventions. In the systematic review of 92 studies, so I actually looked at a few research studies, researchers identified that ethnographic methodology has been used predominantly in public health nutrition and to a lesser extent, clinical nutrition and food service practice areas. This methodology provides a way to increase understanding of complex health issues and their contributing factors, which explain health inequalities, direct policy, and then informed intervention design and delivery. So wider uptake of ethnographic methodologies as standalone or complementary study design will help to explore and address contemporary food and nutrition related issues. So I want you to have a few key takeaways. So if you don't remember anything, remember this, and I'll summarize this at the end. So designing, implementing, and evaluating interventions requires knowledge about the populations and communities in which interventions are situated, including knowledge from the IMIC, which is the insider's perspective. So once again, as you're working in communities, make sure you involve people from the community in the intervention design and implementation and evaluation. So obtaining an insider's perspective and analyzing them in relation to cultural, economic, and structural features of social organization and societies is the central purpose of ethnography. So not only do you look at people from the surface, I don't know if you guys seen the iceberg concept of culture, but there's a lot of things below the surface that you can't see or you don't know about. And that requires you getting involved. Just because I identify with Black, I don't know a lot about the Somali population in Minnesota. So I too have to do this exercise. Just because I look, the same as a Somalian person doesn't mean I know everything there is about culture. And that could be Jamaican, Haitian, Nigerian, and so forth. So, always look below the surface when you're looking to delve into a person's culture. And so the last point is, ethnography provides important insights for determining how best to fit aspects of program design and implementation in a different environment or cultural settings. So those are the key messages, and then I'll, cover those again at the end. So next slide. So what is ethnography? Here's a great picture of people doing a traditional African dance. So ethnography involves investigating activities to generate a description of the social cultural context of a population. The description is typically available in written form. An example would be a report, monograph, or a journal article, although narrated visual products, a film, a video, and photographic book may also be considered. So I'm sure many of you have looked at ethnographic films related to in a documentary format. So ethnography has its roots in the discipline of anthropology, which is literally the study of man. And in the 19th century and the first half of the 20th century, ethnography was conducted primarily through lengthy field work in living in communities around the globe. Classic ethnography was set out to describe the human culture, resulting in monographs that cover a diverse range of topics, which included technology, religion, family, diet, health, interpersonal relationships, and other various aspects of one's culture. Often the ethnographer paid special attention to a particular issue, a personal or current theoretical interest, but the requirement to be comprehensive was part of the professional expectations. The task of generating the description of a culture took many months of research, often as many as 24 months, in a specific community or delimited geographical location. This lengthy period of field work was essential for ensuring academic rigor. And so we know we'll talk about most of you do not have 24 months to study a particular culture. So we'll give you the Cliff Note version of how to do some ethnographic work. So before we do that, let's use the chat. So I want you to put in the chat, how do you currently learn about other people's cultures? And so once again, I have my way of doing it, but I definitely want to hear from you, and put that in the chat, and then we'll call out a few points made by the audience. So I'll give you a few minutes to gather your thoughts and do that, and then I'll look at the chat.
And the question is, how do you currently learn about other cultures?
Correct.
So I'm going to chat that just in case you're a visual learner like me.
All right. So we have, thank you, David, typically documentaries or conversations with others. So that's a great way. Podcasts, talking to people from different backgrounds. Storytelling on public radio. So that's definitely a part of a lot of Native cultures. Learning about other cultures through interaction, videos, discussions, webinars, documentaries, TV shows, reading, movie news. So we got a community events. Yep. Spending time with family members and learning about food, recipes, reading. So these are a lot of great ways to learn about other people's culture. So, all right. Ask questions. Yes. Approachable to celebrations outside of my culture. Allow for curiosity. Thank you, Carmen. Thank you, James, Darlisa, Debbie. Debbie is part of my fellow AHS alumni. She's the new president, by the way. So you'll be hearing a lot from Debbie. Hard key. I hope I'm pronouncing this right. Lamija, thank you for food. Robin, Joanna, Tina, thanks. Hannah, Keenan, Kirsten, Karen. I'm also doing this for selfish reasons, looking at some of my buddies that are on the call. So this is great. Thank you. I wanted to kind of hear from you, and it kind of lets me know that some of my recommendations are kind of on track. So once again, we talked about, typical ethnographic strategies took months or could be years. So here's some practical strategies that you can use that don't take as long. So today, most health professionals don't have the time or resources to conduct lengthy observations and interviews to collect data. However, there are several ethnographic strategies that individuals and organizations can employ to develop an insider's point of view and understand what concerns them most. Ethnography generally employs a mixed methods approach, meaning many different ways. You guys looked at videos, read documentaries, talked to people, attended events. We consider that kind of a mixed methods approach in a real life scenario outside of academia, typically using a combination of observation, participation in social life in the community, informal discussion, open-ended question guides. This is really important. I think somebody mentioned asking questions versus assuming. Survey type questions, cognitive mapping techniques, and both qualitative and quantitative analysis of data, depending on the purpose of the study or theoretical orientation of the investigator. So here are some practical tips for individuals and organizations to use from an ethnographic standpoint. So there's a tendency for humans to associate themselves with people who are similar, with similar backgrounds and views on life. So The tip would be to increase the diversity of your social circles to learn about others in an authentic way. So yeah, the majority of my friends look like me, but I do have other friends either through college, through service, through work who don't look like me. I think it's important to have a diverse set of friends so you can learn about people in an informal, authentic way. So when traveling, you want to definitely immerse yourself in the local culture by learning the local language, eating local foods, and experience other aspects of local culture. I know this sounds intuitive, but I can't tell you how many times I've traveled to another country and people would ding us, especially Americans, for not taking time to learn hello, how are you, where are you going, what's my name, money denominations, and going to a popular restaurant that's currently in America, probably with golden arches or something like that, versus eating the local foods, listening to the local music, and learning the local customs. So that's very important to immerse yourself in the local culture when you're traveling abroad. In major cities like Chicago, you can learn about other cultures by visiting a wide range of diverse events that feature everything from food to traditional dance. So, and to avoid unconscious bias, don't assume you already know the answer about someone's culture. Ask questions to show respect to that person, and you're genuinely interested in their perspective. In a truly equitable relationship, there's no one person that has more power than the other. Advocate for shared decision making instead of telling someone what to do without their input or agreement. And so, one of the best things that I did in an exercise psychology class taught by Professor John Combe Lilly was learning about motivational interviewing, learning that a person is an expert of their experience and you need to facilitate the intervention. You know where they should be going, but you need to ask that person what can they do that makes them feel most comfortable and how to get there. It might not be all 5 steps at once. It might be a different way to do a step, but at the same time, you, instead of telling someone the 5 steps, you work with them to find out what they can do from their perspective to be able to get there. And so many experts have studied other cultures using ethnography. And so many of you talked about reading material developed by cultural experts to shorten your learning curve. And diverse organizations have been proven to be more profitable and innovative compared to those who are homogenous and monocultural in their organization. So to avoid this, you want to employ a diverse array of individuals from historically excluded groups and a wide variety of individuals. And to gain an insider's perspective, it's best to practice to form advisory groups in partnerships with trusted members in the local community. Is the slide all in steps? So the slide is not going in any particular order. You can take one of these steps or you can do one or many of them, but there's no sequential order to the steps. Hopefully that addressed the question. So these are just some ways that I think. So it does, I kind of organize it from an individual to an organizational perspective. So that's about the only thing. So thanks, Joanna. And so, and then the last point is recognizing that many people may not feel comfortable doing ethnographic research. So organizations can hire someone to collect the needed cultural data and share it with staff and other members. So once again, this might come in the form of questions you should ask or kind of cultural guides that once again are not monocultural in nature, that look at a wide variety of cultural aspects. So next slide. So I found this one is a little interesting. I was Googling pictures, and this is like a picture of ice bucket challenge, what it means for, our social media culture in America and what ice buckets might mean in other countries. Working for the Department of Agriculture, waterways and water rights are huge. Not everyone everywhere has access to potable drinking water that's safe to drink, and it can be used for bathing and other purposes and cooking and so forth. So without doing some type of sterilization to it or some type of, chemical treatment. So why is ethnography important? In each culture, people have different values, aspire at different aims, follow different impulses, and desire different forms of happiness. To study the institutions, customs, codes, and behavior without the subjective desire of people to realize what their happiness is, in my opinion, is a missed opportunity and the greatest reward in which people can hope to attain from the study of man. So finding out, how other people, what makes other people tick, I think is very important, and not just looking at motivations from your particular cultural perspective. So historically, much of food-oriented ethnography was motivated by a strong concern about the health and welfare of native peoples whose lifeways were being transformed and destroyed by colonization in the march of civilization. So right now, I'm a tribal affairs specialist. I'm sure if you guys have history buffs, you know that a lot of the indigenous foodways, the right to hunt, fish, gather, were taken away when people were moved off their lands and forced to subscribe to commodity foods that were not part of their original culture. And so, yeah, we definitely have to look at, how Western culture influences people who are not native to that particular culture, how that influences their food ways, nutrition, and overall health. So much of ethnographic work in the United States is aimed at countering the Western-centric view of health and nutrition and advocating for the integration of diverse cultural perspectives into shared decision-making. Once again, is whatever you do, whether it's personally or if it's professionally, if you're trying to get someone to do something that you know is the right thing to do, i.e., eat, all the different macronutrients, eat in balance, eat whole foods, you definitely need to look at their particular circumstances and then work with them to figure out what can they do in a staged approach to get where you need them to get to. So now I'll discuss a few examples of ethnographic research that was undertaken for the explicit purpose of informing and guiding decision-making and policy. So I have a few from public health nutrition, some from clinical nutrition, and some from food service. So the first example really talked about diet, which is a complex social cultural act providing biological, nutritional, political, and social dimensions, to nutrition. So the aim of this study was to identify the changes in the school food service program in Medellin, Colombia, and to interpret the perception of the program's beneficiaries. So ethnography was conducted with schools beneficiaries and their parents, school counselors, program coordinators, food handlers, and nutritionists. So what they did was they looked at historical archives and the minutes from municipal council meetings, and they reviewed those to collect historical information, reports, and correspondence. And so in the supplied speeches and preparations that they studied, the absence of cultural references was identified. So really didn't need to talk to people. They looked at historical data and found out that, culture was not integrated. And young people have culture too. And so not just adults, and, was not integrated in food. And food is very personal. And a lot of young people, they get 30 to upwards of 50% of their calories and nutrition from school food service. So it's very important to have a robust food service program. And so I'll get to Ina. She asked if I'm looked at nutrigenomics. I've looked at that as a dietitian. But yeah, that gets down to a biological level as far as getting outside of culture and looking at someone's genome as far as prescribing nutrition. So nutrition interventions. And so the conclusion for this particular study was the food program helped to reduce the suffering caused by hunger, but it was not always designed thinking about cultural aspects that involve food. So when you think about cultural aspects involve food, it's, what are your parents cooking at home? What's native food that you might be used to? There might be a generational gap. Parents might still be cooking native foods or indigenous foods, and then the school food system might be doing a more global or another approach. And then also simple stuff with everybody: appearance, taste, texture. Those are all things that should be interwoven into nutrition interventions. And so the next example, please. And so this is another public health nutrition example. So this was done at the request of chronically ill Aboriginal patients in Central Australia. So this ethnographic research was conducted to provide a better understanding of how diabetes sufferers cope with their illness in everyday life for the creation of a more culturally sensitive health program. And so based on analysis of participant observation data, so here they use observation and semi-structured interviews, so they talk to folks with diabetic sufferers and their kin, which is very important because a lot of times diabetic patients need the support of their family. You can't have diabetic foods that are unfriendly in the house and other people are eating those while you have to be on a diabetic friendly diet. So that usually doesn't work well. And then they also had conversation with medical staff working at the local clinic. These were the clinicians who were supporting the diabetic patients. The research team learned about contemporary Aboriginal dietary practices. So any recommendations they had matched these dietary practices. In the post-colonial demand sharing economy, this is, I had to look up demand sharing. It's, doing what's for the greater good. So food banks, I work for the Food and Nutrition Service, which does food security. So taxpayer dollars goes towards feeding people who are experience hunger. So that's kind of, one of those things where you talk about demand sharing and deployment of various regimens of care and health promotional initiatives, making sure those tie back to Aboriginal culture. So it was discovered through the study that the diabetic patient lack access to diabetic friendly food. So that's why, having the kin perspective was important, the family. And to cope and make sense of their chronic illness, diabetic patients switch between different regimens of care, which included biomedical. So that's, a glucose monitor, could be taking insulin or oral medication like metformin, and demand sharing economy, kind of doing what's best and good. And then in traditional and Christian religious practices. In example one where they're comparing two schools against each other. I don't think so. I think it was just looking at one school food service program. So great question. And I want to get back to traditional and Christian religious institutions. Sometimes when people have an illness, as clinicians, we have to understand that some people prey on it. And they think what they can't do on their own or with modern medicine, they might put it in the hands of a higher being, and you have to respect that. I was always taught to look at what man or a woman can do who has been gifted to do a particular thing to help heal people. And if you can't find the answer through exploring all aspects of what this world has to offer, then you might have to prey on it and ask for extra help outside of what, man or woman can, physically do. But, I'm a big proponent of going to the doctor and getting clinical care and getting culturally competent clinical care. And so, as I've gotten older, that's become really important to me. So the last point about the study is so they ensured a certain level of success. The long-term health promotion initiatives needed to be grounded in indigenous caring of looking after each other, and then relying on realistic collaboration between patients and their kin, and then the local healthcare providers and other community-based organizations. So this is one of those things where they recognize that an individual alone might not be able to be successful in all aspects of the care. So they involve the family. They looked at, involving the clinician, but the clinician also had to factor in cultural practices. But then they also, looked at community-based organizations outside of the hospital that could be involved in care. So next slide. So we're going to actually skip this one because it's another public health nutrition, and I'm looking at the time. We got another question for the chat, and then I also want to leave time for Q&A. So we'll go to clinical nutrition example one. All right. So this is another one related to type 2 diabetes. And they looked at underserved populations in a low-income Hispanic community, primarily focusing on women. So this population had a higher rate of type 2 diabetes, diabetes-related complications, obesity, sedentary lifestyles than the general US population. So dietary management was critical in the aspect of diabetes care, but it was the most difficult health behavior to modify. So they did a qualitative ethnographic-based study to identify cultural habits of Hispanic women. And they participated in observation, individual interviews, and they explored relationships of culture, food habits, and type 2 diabetes among low-income Hispanic women residing in an impoverished rural community located on the Texas-Mexico border. So, there's usually a difference between rural and urban, the type of resources that are available and access to healthcare, food, organizations, and so forth. So the women use unique strategies to adjust their diet, particularly for portion control, for example. They emphasize the use of a fork based on the notion that Hispanic finger foods are less healthy. Finger foods might be the foods that you would get from a vendor cart or other foods that might be considered snack foods. Um, and then the women categorize the foods as bad or acceptable. I try to tell people that no foods are bad. I like people to have a healthy relationship with food, but in this particular study, women did categorize foods as bad or acceptable, depending on the context, such as important family or social gatherings. So, and once again, they did that from their personal perspective and didn't, want anyone else to adhere to the same prescriptions that they had on food. So, those with expertise in making changes on how to eat and care for their diabetes, they did it maintaining cultural foodways. So that this was very important. So they found a way to engage with food, but also keep their culture intact. So the conclusion was foodways are critical to most cultural groups, and modifying dietary behaviors can be challenging. So clinicians must develop self-management guidance within the social cultural context of patients if diabetes are to be improved and to be sustained. So the whole point of this is look at the cultural context. If you're telling someone to rip out their traditional diet and eating something and preparing something that they're totally unfamiliar with, that's not going to be sustainable. They did some simple tactics in this particular study: portion control, figuring out which foods are good or bad, and managing things like social gatherings and so forth. And so next we're going to go to the last example, which is a food service example. And so so this talks a little bit about emergency foods environments and so forth. So charitable services make a substantial contribution to the food and nutrition intake of vulnerable people and thus offer a platform for dietary improvement. This study examined the food provisioning by a large charitable organization in a major United Kingdom city. It has several objectives. First, they wanted to quantify the nutritional composition of breakfast and lunch meals. Second, they wanted to understand the factors that influence the composition of menus and meals. And third, they wanted to determine whether within the context of these influences, improvements to menus will be possible and whether these will be acceptable to clients. So once again, you can improve the menus, but are they going to be acceptable to your particular target population? So mixed methods of ethnography was used. So semi-structured interviews, quantitative nutrient analysis, recipe adaptation, and taste tests were employed. So the research team worked as volunteers in the organization for a 3-week period, and interviews were held with the kitchen staff. So once again, this didn't take that long to do, but they did a little bit of upfront work to be able to learn about their client population. So food choice was recorded for 189 clients at breakfast and 251 clients at lunch over a 5-day period, and the nutrient content of these meals was estimated. So meals are weighted towards fat and sugar energy. The energy, potassium, calcium, vitamin C, vitamin A, zinc, and magnesium content of meals were below the dietary reference value. Targets for at least 20% of breakfast and lunch meals. Such inadequacies may be addressed by the addition of simple foods to breakfast menu and adaptation of lunchtime recipes. So to counter if things are below the recommended daily intake, you would supplement those particular meals with additional foods that, once again, are culturally appropriate. So 12 lunchtime dishes were proposed, and 8 of these were seemingly acceptable to clients in taste testing. So, a large majority of the meals that they tweaked were acceptable, which is good. And once again, they were supplementing these foods to create a balanced meal for their client population. So barriers to provision of healthy meals included budget, once again, which talked about economically and social determinant of health, and food donations and acceptability of meals. So once again, don't exclude things like taste preference from any nutrition intervention that you design. So we can go to the next slide. And so, as we conclude, I want to be able to wrap up some of these key points, and then we're going to ask you a question that you're going to put in the chat, and then we'll open it up for Q&A. So remember, behavior change always occurs in a social cultural context. You have to look at all those social determinants of health when you're looking at that. So therefore, knowledge about the context is of a cultural context is fundamental prerequisite of being effective when you're designing intervention. Ethnography as a method provides a means for acquiring and interpreting this cultural knowledge. Ethnography provides us with methods to understand insider perspectives of features of local life and conditions that relate to interventions and actions. You guys already put a lot of different methods that you can use in the chat. You looked at interviewing, going to events, reading books, looking at documentaries, having conversations, expanding your friend base. Those are all different ways, or what we call methods, to learn about someone else's culture from their particular perspective, if you don't have an insider perspective. And so we want to reiterate the key points that I mentioned before. So designing, implementing, and evaluating interventions requires knowledge about the populations and communities in which interventions are situated. So obtaining insider perspectives and analyzing them in relation to cultural, economic, and structural features of social organization and societies is a central purpose of ethnography. So ethnography provides important insights for determining how to best fit aspects of program design and implementation into different environmental and cultural contexts. And the last point, there are several effective ethnography strategies that individuals and organizations can use to gain better insight of the populations they serve or want to explore. And so, and once again, you guys put many of those in the chat. And of course, I, expounded on a few of those and the things. So the last question we want to ask of you, and once again, use the chat feature, is now that you've learned a few more methods, what are you going to do differently? You guys put some really robust things in there, and not everybody probably does all of those, but what are some tips in that you kind of learned throughout this presentations, or some things that went off for you, some light bulbs of things you're going to be doing differently to learn about others' cultures as you move forward? So I'm going to look at the chat.
You've shared so much wonderful information. It's a lot to sort of think about.
Yes, I know that was a floodgate of information.
But I think your point about light bulbs, like what were some of the things that went off for people that were eye-opening, just to help to think about even how to do things a little bit differently.
Mm-hmm. So I want to go back to a few questions that were put in the chat as well while you guys are continuing to type. I mentioned about nutrigenomics. So for folks that are not familiar with that, you're looking at prescribing a nutrition regimen based on someone's gene type. So, my sister and I probably, because we come from, the same parents, probably have a lot of, gene types in common, but there might be some slightly different. And so her nutrition prescription might be slightly different than mine, but there might be a lot of similarities. This could be carb protein ratios along with fat. She might need, more, she might need more vitamin D if she has, a bone disorder or something like that. So you get down to the gene level when you're looking at prescribing nutrition for folks. I mentioned that, I think it was one school that they looked at for the first public health nutrition example, and it's looked at the students at that particular school. And then the information that they used was across kind of the school district. So Alyssa talked about being more intentional about learning more through various strategies mentioned. Joanna, basically, it's very important to me to ask questions without assuming things. Christina, use some evidence-based strategies, ethnography being one of them. There was a lot of great books out there on Amazon. Michael, including members of the community you're working with in designing the intervention, that insight is most valuable. Yes, so advisory boards, employing folks as contractors or, full-time or part-time employees, Kirsten, never assume that you understand someone's background. Even if you know they're from a certain religion or race, that does not necessarily mean that they fall into a box. Ask questions and listen. So yeah, that's very, very important. So Christina, the patient has to feel comfortable enough to share what they really eat. That is important. So that trust relationship is different people have different ways on how they build that very quickly. A lot of times when I was doing my internship in the hospital, you don't have very long to establish a relationship with people telling you what they truly eat. And so, you crack a joke, you find some commonality, you share a personal story, whatever it is, you need to be able to build that trust so you can get honest insider perspective. And Genesis, having self-awareness of not only what people need, but why they need it and how they can best benefit is very important. So thanks everyone for sharing, what they would do differently. I think it's perfectly time. I want to leave 10 or 15 minutes for some questions. And so feel free to ask questions either about the presentation or anything around, cultural exploration. We have a great group of folks on the thing. Other folks can, chime in and give their perspective on how they would address that question as well. It's not just up to me. So feel free to put some questions in the chat, either about the presentation or about the topic of ethnography in general.
Well, thank you so much, Eric. And as people are
Yep.
typing in questions, and certainly we encourage them, as you've just suggested. We had a couple of pre-questions that came in.
Okay.
But one, I have a question. I'm going to go a little bit off the cuff. If this is the first time somebody is hearing about ethnography and this is a new concept to them, is there, and the answer to this question may be no, is there one book you would say, yes, check this out as a resource to really start to explore and discover more, or one resource you might point people to?
That's an interesting question. When I was coming across, I came across a few articles. One, let me look at the articles for all the academics while we're doing this, so I can give you narrowed it down. I use Google Scholar in Google to find these particular articles.
It may not be just one particular thing, but as I was thinking about some of our audience members that, if they were curious about what's the next step, where should they go to kind of discover more?
Yeah. So, for folks that are interested in, how, what I use for research. So the Academy of Nutrition and Dietetics did a systematic review. When I talked about, they looked at 92 studies. I don't know, unless you guys are into research, whether or not you want to read all 92 studies, but they did a systematic review. It was called Ethnography in Nutrition and Dietetics, and it was published in 2018. And so if you're a member of the Academy, you can kind of pull that down. And then the other one that I found was really good was Maternal and Child Health Journal, using ethnography and implementation research to improve nutrition interventions in populations. So, and this one was published in 2016. I didn't look at any books. I know as far as current faculty there, Dr. Angela Odoms-Young actually, when I was talking to her about consulting on this particular presentation, she actually did a dissertation on ethnography and considers herself an ethnographist. And so I think the study is, so I didn't come across any books. I did, Google some, and I did look on Amazon, and there were a few, but I don't have any to recommend. I was looking more so on extracting the methods that ethnography uses, and I think those approaches would help people learn more about other cultures. So the ones that were coming up in kind of in mass that were common were reading existing material published on the analysis of one's culture or community's culture. Observation was big. Interviews, like focus groups, one-on-one, one-to-many, surveys. Of course, you got the culturally design the survey so it's effective. And and then kind of cultural guides in which you put a little bit of information out there, but then it also talks about asking questions about what religion do you support, because that might kind of guide someone's nutritional preferences and practices. And then the biggest one is like, if you don't know, don't assume, have a conversation and ask. So that was the biggest things I would say.
What I was really doing was setting you up to write a book.
Oh yes,
Intentionally,
I
that's
would.
what I was doing.
Oh, cool. Well, that's a good setup. I am not going to take that alley-oop. It's kind of outside of my lane. I just thought, doing diversity and inclusion work, a lot of people was like, how do you learn about other people's culture? And I'm like, well, when I was in the service, I was 17 and I was a Russian linguist. So you take a black kid from the south side of Chicago, and of course, I traveled a little bit when I was younger with my parents, but then I'm in Turkey and I know Russian, and it's like, how do you begin to learn? And you can't say, do you speak English, or where is this, that, and the other. So you have to quickly learn the language. First of all, it was a safety thing, because people, they spot you, and then you have to be able to build that trust relationship. So I didn't look like a complete outsider. And so I quickly learned that cultural immersion for me was very big. Language, food, dress, cultural norms. If you're in a country where they don't extend their right hand to shake for reasons, then you need to adhere to that instead of doing the Western practice of trying to shake everyone's hand. In some cultures, found that men hug each other and kiss each other on both sides of the cheek, and I needed to get comfortable with that. And so I just wanted to share something that I came across that was a cool way of doing it. And so to dig deeper into it, I think would be awesome. But I think people like Professor Angela Odom-Jung is probably better suited to write a book. And I'm sure you got some really great academics there at the school who have probably done this type of work. So
No pressure,
Lowell,
just the wonderful knowledge base. So it was just more of a suggestion, which actually there was a question that came in chat. I'm not sure if you saw it, but it really
right.
leads into what you're talking about right now, which is how have you utilized this information and concept in your current and prior roles?
Yeah. So, okay. So if you can go to the next couple slides. I don't know if you're disseminating slides. I actually have the references in there for the articles and the examples that I use. So Christina asked about citations. Emily Ann put a reference to PubMed. Learning for Justice was something that Genesis put out. And Lowell said the geographic latitude of residents might need to be considered. A person with low vitamin D and high cholesterol will live healthier near the equator for more ultraviolet light to synthesize cholesterol into vitamin D. All right, so
I just want to remind everybody that we are recording this and the slides will be available online, so people don't need to quickly jot this down or anything.
Yeah. So, and for folks who are not nutrition experts, so that particular quote, vitamin D is, can be obtained through sunlight. And so for areas that don't have ample sunlight, there's different things that, different approaches people need to take. So I'm gonna go back to Kirsten's question. How have you utilized this information and the concept of ethnography in your current role or prior roles? Great question. So I went from being a nutritionist in the SNAP education program, and SNAP education really dealt with health education and promotion for low-income populations, which was for SNAP eligible populations, which is a wide variety, and usually working through land grant universities and community partners. So recently I transitioned to become a tribal affairs specialist. So I felt like a baby. There was so much that I had to learn about Native communities, American Indian and Alaskan Native. And so I was thrust into this role. And just because I identify as, a Black person, so you've heard the term BIPOC, Black, Indigenous, and people of color, doesn't make me an expert on cultural diversity in everyone's cultures. So I'm looking over to my right. We purchased about 12 books on everything from treaties, historical treaties. I think there's over 370 treaties that the United States entered into with native populations that need to be that come up in legal. And interesting fact that a lot of native communities are sovereign nations, which means they're their own nation within a nation. So they're not a state, they're their own government, and they govern themselves. And so that was part of some of the treaty rights when we done way back when. um there's different dialects of language, different indigenous foods that people are trying to bring back, different cultural food ways. And one of the things I can really appreciate about learning about tribal culture is they have this interaction with the land. So they harvest and kill, hunt, fish, and gather foods in a culturally sustainable way, meaning that they don't overharvest or they don't overkill animals, and able to give back. And they think about things 7 generations ahead. It's like, if I do this now, what will 7 generations ahead of me, will they be able to have, if based on my actions? So it's a really forward thinking concept that's been around before America, of course, was founded. And so I've had to learn a lot. So a lot of conversations, a lot of asking questions, a lot of reading, a lot of immersion in this listening, um, a lot of respect, a lot of studying of history, so we don't make the same mistakes, or you understand the needs that have been put forth for hundreds of years, because tribal citizens hate retelling their story to the next person. They like, this has been documented, we've spoke about this, you're in this particular role, the government spends billions of dollars, we need access to this, so we need you to quickly get on board with saying. So I've personally, over the last year and a half, had to practice what I preach, and do all of these things that I mentioned, because I was not as familiar with Native American culture as I should be going into the role. I think there was another question. Love that thinking from Tina. All right. Can you say your name, the current title again? Yeah, so Genesis, I work for the United States Department of Agriculture, Food and Nutrition Service, and I'm a tribal affairs specialist.
Well, Eric, thank you so much. I mean, you have such an incredible, incredible knowledge base, and thank you for sharing all of this wonderful information, very thought-provoking, and really have enjoyed the conversation and discussion, as clearly our attendees have too, by their interaction in the chat. We're very, very proud that you're a 3-time graduate and that you're a wonderful alumni volunteer, and just thank you again for all your time today. We're very, very grateful for you.
Thank you for having me.
Oh, I'm sorry. And then just to close us out, please join us for our next Alumni Exchange program on Wednesday, July 28th at noon Central Standard Time, when we will be joined by another UIC alumnus, Daniel Kiss. Daniel is a senior home lending advisor and will answer all your questions about home financing and the mortgage process. This is a follow-up to our very popular Home Buying 101 event that we hosted through Alumni Exchange, and we encourage you to attend if you're thinking about buying a home in the near future, as he presents Mortgages Demystified. Very different, obviously, from today's program. To find a recording of this episode or any of our past episodes, please go to go.uic.edu/alumni exchange. And please be on the lookout for that quick survey I mentioned at the beginning, because we appreciate your feedback. Thank you again, Eric, for all of your time and sharing your talent with us today. We're very, very grateful for you. And thank you to all of you for attending. We look forward to seeing you at a future UIC Alumni Exchange program. Have a wonderful rest of your day.